I told you about the last slide, the last X-ray, putting that X-ray with this, what do you think those might be? Yeah, they're secondaries, in fact. So this, the radioisotope bone scan has shown up really quite a large number of secondaries, all up here. Okay, in the ribs, and up in the skull, for heaven's sake. That's not a secondary, that's just radioisotope in the bladder. So don't be confused by that one. So the patient has widespread bony secondaries. So here we're looking at disorders of structure. Disorders of structure. And this is the third level at which diseases show themselves. Disorders of structure and function. And this patient has an abnormal bone scan. You see what's happening? We're building up a picture of the way in which this patient's disease is showing itself in the patient. Well, I just ask you, what is a diagnosis? Most people would say it's something like hypertension. It's something like cancer of the prostate. It's something like a label, which is written on a patient's forehead. That's not right. That's just a label. A diagnosis is what is going on here. What is going on here in the patient? How is the disease showing itself? Because it's only when you've started to build up this picture you can think about treatment. What do patients come to you for? Well, why do patients go to doctors?
Help, treatment.
Treatment. Bottom line, treatment. Because not for anything else, mainly, it's treatment. So your whole effort, your whole team is focusing on effective treatment for your patient. That's the bottom line. And so it's not good enough just treating the symptoms, for example. Who would treat this patient with cancer of the prostate with analgesics only? Good. Nobody would. You want to take into account the whole manifestation of the patient's problems. Sorry, forgive me. I've got a bad cough. So now we need to make a histological diagnosis. Clinically, it looks like prostate cancer, yeah. But we need a histological diagnosis. Why do you think we need that?
Confirm diagnosis.
Yes, I was
To confirm diagnosis.
to confirm the diagnosis, yes, because some of your treatment's going to be quite radical, possibly. Any other reasons why you confirm histologically the diagnosis of malignancy? Select the treatment. Good. Okay, select the treatment. Okay.
To determine if it's benign or...
Yes, okay, the level of malignancy and the type of tumour. And it helps you with your prognosis, helps you with your staging, helps you explain to the patient what's going to happen. But we'll come to that in a minute. I'm sorry. Okay, this is the grading system which is used for staging prostate cancers. Don't worry about the details. What I'm saying to you is that there's an internationally agreed standard of grading the malignancy of prostatic tumours. This relates to the prognosis and to a certain extent to the treatments that you will use. Okay, so the pathology of this patient, and we come down to the level of pathology, is prostate cancer. Does anyone have any water in it? Okay. What about causes? Well, I don't think we really know what the causes are. Maybe there's some genetic causes. One thing I just want to pause a moment. Who is doing all this diagnostic work? Is it the family doctor? Is it the oncologist who's doing it all?
Urologist.
The urologist who's doing it? The psychologist? I'm going to suggest that no one person is doing it all. The first person the patient may see will be the family doctor, probably. The family doctor is required. A radiologist may be required. Radioisotopes may be required to do the scan. The neurologist may be involved because of their specialist knowledge. Surgeon may be involved. All sorts of people may be involved in the care of this patient. They will need to work as a team. Because at each level, and we haven't tackled these yet, at each level there are experts. Experts at understanding the symptoms, what they mean. Experts at examining the patient. Experts who can interpret the x-rays, interpret the bone scan. People who know about the histology. Okay, so it's a diagnostic team working together. Now I have to say, I've taught in Eastern Europe for about 10 years, and one big problem, particularly in post-communist countries, is lack of teamwork. Lack of teamwork. There's the boss, and then there's everybody else underneath. Okay? That's the way the team works. And people are reluctant to share information. I hope it's changing, and I hope it's not like that where you come from, or where you're going back to practice. But teamwork is essential for the effective care of this sort of patient. Here's the patient's oncologist. So what should she tell the patient? Fantastic. It'll all get better. What should she say? You'll be fine. It's just a little blood in the water. Don't worry. No. I tell you what, I know the patient. I'm the patient. You're the oncologist.
With the diagnosis?
Yeah, I know nothing. I've just had a lot of investigations. And I've had blood in my water, I'm feeling all right apart from that. So you're the doctor, you may be the general practitioner, you may be the urologist. So doctor, what is it?
Sit down.
Sit down.
Okay, you might want to get the patient seated and comfortable, and try to present the progression of tests and results that you have.
Okay, that's a really good point. A little story. It started like this. We began to see this. It looked like that. Okay, I like the progression.
And then, based on that, you give him your conclusion of what you suspect it is. You probably have met another specialist who confirmed your diagnosis. And then you present the patient with his options. You can leave it like this, it's benign, or if it's metastatic, or there are certain procedures you could take.
Okay, good. Okay, I'm going to stop you there. Can you tell me your name? Godwin.
Yeah.
Godwin's presented this nice, steady, methodical, systematic, gentle work through what I'm saying. Well, bad news, I'm afraid, it's cancer. Or, there's nothing much wrong with you, but we'll soon sort you out. Or something like that. And confirmation of the diagnosis. Using colleagues again to make sure you know what is going on. You don't want to talk to the patient in ignorance, not knowing the full story yourself. You need to be prepared for this. Explaining what the situation looks like, and let's discuss now the treatment options. The 7-level model has two sides. One is the diagnostic side, and we've been working through that. The other side is the treatment side, because we need to have, that's what the patients come for. So, I know this doctor very well. And she says, the biggest mistake you can make is to pretend to the patient that something is going to happen which is not going to happen. To give them false expectations. Because when that thing does happen, and they recognise that you have not exactly lied to them, but you haven't told them the whole truth, then your relationship is broken. And you can't help them anymore, or it's difficult for you to help them. And your presence is powerful. You, personally, without all the drugs, without all the surgery, you are powerful. Force for good and for healing for this patient. Never underestimate the power of your presence. That will be particularly important as this patient's journey progresses and they come maybe near to dying. You don't know what to do. Don't underestimate the power of your presence with the patient. There are times when you can't do anything except be there. Be there. And when they've learnt to trust you, they know they can trust you, your presence will be powerful. Doctors don't believe that. Believe me, it's true. So, okay, look, the patient is your brother, the patient is your father. Here's the doctor. What sort of qualities do you want this doctor to have? What sort of doctor should she be?
Someone who knows what she's talking about.
Yes, competent, knowledgeable, knows what she's talking about. You can be as nice as you like, but if you're ignorant, you don't know what you're talking about, no good.
Self-control. She must have a good self-control over emotions and over her actions also. So that she has to treat, if she has to treat her family members, then she knows.
Good.
Empathy.
Empathy. What does empathy mean?
Not sensitive.
Being able to feel.
Not sensitive.
I think it
Being able
means
to feel with the patient.
okay. To name and understand what the patient is feeling. Just to be able to name the feelings and understand them. Okay, I'm just because we're all quiet thing. You all have role models of people that you want to be like, doctors that you want to be like. Hold on to those role models. There are many